My name is Hadley Wesson. I'm a general surgeon with the Johns Hopkins Community Physicians Group at Howard County General Hospital. An inguinal hernia is a defect in the abdominal wall at the level of the groin, which can result from a couple things. It can either be there since birth, and abdominal contents can protrude down a normal opening that people have in their groin, or it can be caused more often in adults with a weakness in your abdominal wall lining. If you can imagine an adult standing up, the greatest pressure in their abdomen is in their groin due to just gravity and the fact that the abdominal contents sort of drop down into the pelvis. And if you have a weakness in your abdominal wall, that can cause a protrusion of the abdominal contents into your groin. When patients have an inguinal hernia, they can have a variety of symptoms. They may notice nothing at all. They may notice a small bulge that is present when they cough, because coughing is going to increase your intra-abdominal pressure, and that may cause those contents to protrude out if there is this defect in your abdominal wall. It's my recommendation that all people who've noticed a bulge in their groin or who are concerned that they may have an inguinal hernia have an evaluation by a surgeon, such as myself. In this way, the individual can come to my office, I can examine them, and I can sit down and talk to them about the risks and benefits of a surgical repair. Not only will surgery help to alleviate the symptoms that they're having, such as a bulge, whether it's tender or not, bothersome or not, but it can also decrease the risk of complications from the inguinal hernia. With any hernia, because it's a defect in the abdominal wall, the abdominal contents can protrude or push through the hole or the defect. The complication is when the bowel contents can get stuck there. So for example, if the small intestine or the large intestine can work its way through the hole and get stuck there and not be able to push itself back in. Over time, what can happen is this can compromise the blood supply to those intestines, meaning that the intestines aren't getting the blood supply and the oxygen that they need to be perfused. If this happens, ultimately, it can jeopardize your intestines, and that becomes a surgical emergency. And that's what we want to try to avoid by repairing these way before that happens. In terms of the surgery to repair an inguinal hernia, it can be done one of two ways. It can either be done laparoscopically or it can be done open. And the decision as to whether or not to perform it laparoscopically or open is really made on an individual basis. When the individual comes to my office and we sit down and talk about the type of surgery that they would have the best success with. If we perform the surgery laparoscopically, usually what would happen is they would come to the hospital in the morning. They would meet with the anesthesiologists, they would see me before the surgery, we'd review any questions that they or their family members have, we'd bring them back to the operating room. Once they're under general anesthesia and comfortable on the operating room table, we'd make a series of usually 3 small incisions at the level of their belly button and then just underneath their belly button. We perform the surgery using a video monitor and long laparoscopic instruments. It's this way, on the video monitor, what we see is the actual hernia entering the defect in the abdominal wall through the abdomen itself. We reduce the hernia sac, meaning that if we pull it down, and then we repair it, placing a piece of mesh to reinforce that abdominal wall defect. The patient is then awoken from general anesthesia. They're taken to the recovery room where they stay there for a few hours. We make sure that their pain is well controlled. We make sure that they're able to tolerate some clear liquids. And once they feel up to it, most patients are able to go home that same day. For an open repair, the patient will come to the hospital in the morning. They'll meet also with the anesthesiologist and myself. Once again, they'll have an opportunity to discuss any last-minute questions that they or their family members may have. We'll bring them back to the operating room, make sure that they're comfortable on the operating room table. This surgery is usually performed under general anesthesia, which is why it's important for them to meet with the anesthesiologist before the surgery. We start by making a small incision over their groin, over the level of where the hernia is. And then once we find the hernia, we reduce it, and we then usually fix these hernias using a piece of mesh. And we found that the mesh really reduces the risk of recurrence. And similar to the laparoscopic surgery, they're able to go home usually later that day. The recovery on average is usually a couple weeks. The most important thing from a standpoint of minimizing the risk of recurrence is that during this immediate recovery time, patients don't engage in heavy lifting. Usually that doesn't interfere too much with a person's daily activities. We encourage them to walk, we encourage them to climb steps. It's just the heavy lifting that they really want to avoid. Most wounds for this type of surgery are closed with stitches that are buried underneath the skin and are going to absorb on their own. So I ask all my patients to come and see me for a post-operative visit about 2 weeks after surgery. It's at that time that I can look at their wound and also just make sure that they're on the right track to recovery and address any needs that they may have. Make sure that they're getting back to work okay, and if not, really identify the factors that are inhibiting that.